This is a case of presenting. When he called me up, he said, I've got bilateral plantar fasciitis, which immediately piqued my interest because, I go back a long way, and I remember as a student where you had to treat as you were directed by your supervisor, having someone with plantar fasciitis, which I judiciously applied ultrasound to. The theory being that it was all due to inflammation of the plantar fascia. Now, just a historical thing, shortly after I've graduated, and that would have been probably 1974, there was an article appeared in the New Zealand Physiotherapy Journal. It was very easy to write one then because you didn't need much in the way of credentials. You didn't need references. It's a very different era. But it was by Brian Mulligan. And he was talking about plantar fasciitis. And Brian had been a follower of Kaltenborn. He and Robin developed their manual skills in conjunction with each other. A small group of therapists in New Zealand were interested in it. They self-learned, self-taught each other and practiced together. Brian had a particular interest in extremities, and he was the one who presented mainly the Kaltenborn approach. And from there, he used that, I think, as a baseline to develop his own system, which everyone is very familiar with. But he maintained that most of the plantar fascia people that he had seen, it was due to some problem in the subtalar joint. Now, Brian never used the term derangement, but when you read his work and you read McKenzie's work, they're talking about the same thing. They just use different terms. And since then, I would look at these patients in a totally different light. And I found, I'm not finding people who would fall under the category of an injury to the plantar fascia, so a contractile dysfunction. They were invariably something to do with either the subtalar joint or the ankle. Mm-hmm. So I was interested in this person because it's bilateral. Now, bilateral, you're thinking, that's unusual. A bilateral contractile dysfunction would be very unusual, but even a bilateral derangement in each foot would be unusual.
Month after month, new guest experts like Colin Davies presenting actual patient cases like this one and access to all the past. Check out case conversations at mechanicalcareforum.com.